The Catholic-funded Kamuli Mission Hospital, built 100 years ago, runs on the model of service above self. On the day we visited, the administrator, Reverend Father Emmanuel Kawanguzi, was eager to show us around.
Oh, the stamp, yeah.
Though located in a remote area, this hospital is fitted with trailblazing technology.
We have been having a training. When a patient comes, is assessed at 3 different levels. The critical one is given a red color. Red means critical, so you are taken to an emergency room and you are attended to immediately. Now, yellow, it means you are not so bad off, so you can wait for some minute or 2 or 3. Now, green, it means that it's not urgent and important, meaning to say that you can wait at least for another 10 minutes.
This has streamlined treatment at the hospital.
We take what we call the basic information from you.
The information which the patients fill in the forms prioritizes treatment. This training was offered to the staff from Friends of Kamuli, a UK-based charity organization. The organization has also aided the expansion of the hospital.
So we have had our maternity renovated, and we have even expanded it, added on some private rooms. They come and also help us to help these health workers we are training, because we have a training school.
They also set up 10 units for the staff, which has helped with retention. For a hospital which began in the humble 2-thatched huts, it continues to grow by leaps and bounds.
This is one of our oldest buildings on the compound. We are appealing to government to have it torn down and put up a new one. And some of other buildings, like we have the pharmacy. So it's a very nice ward, but when you're admitted here and you go inside, you may not like to stay here.
Kamuli Mission also receives support from the government.
What they call a PHC, quarterly grant, which is about 100 million. And on this, there are 2 things which mainly we do. There's a part for drugs, and there's a part also for topping up of salaries for our staff, but also something else which goes for public health.
But this is not adequate for a hospital which requires to maintain the facility, maintain and replace equipment, and increase staffing levels.
So we are somehow constrained because we don't have enough resources, but even then we manage to work within those limited resources.
Despite the spring, births have found sanctuary in some of the dilapidated buildings. The hospital's antenatal and maternity services are in good state, and maternal mortality is low compared to other non-mission hospitals. Busoga sub-region has 2 mission hospitals.
Our deliveries per annum is like 2,000. And out of the 2,000, 35% are cesarean sections.
A number are referrals.
The most unfortunate part of it is that most of these referrals that come to us are referred in late. For some time, we have been blamed of having a lot of maternal deaths. But then it's because of the delays.
The Mission Hospital has a sound antiretroviral therapy clinic with 1,089 patients. Of these, 970 are on ART. UK doctors also offer free treatment to fistula patients. Though the hospital charges modest fees, it's way out of reach for the poor.
Somebody comes, for example, somebody is sick, beat an accident, is admitted. We attend to this person. And in the end says, well, I have no money to pay. So the challenge is the hospital has to carry that burden. You could call it already a bad debt. But our mission is to promote life, to heal, to protect.
There has been a reduction in the number of patients as more government health centers open.
But even then, we get patients to come here. Because our hospital is a referral hospital in the district. People are being referred here, they come. Even from the general hospital, they come here. We get those cases. Even from Namwenda, we get those cases who come here. Even in Blam.
Kamuli Mission is also grappling with those who default on paying for the services.
We try to send our social worker. We try to send some of our staff to go to the local area and try to trace the person and say, please, can you give us something? Or can you contribute something? Some have successfully paid, but others have failed. And others, whom we could call uncultured, they escape. They just escape, which is very bad. And of course, there are those who pay in installments also. But usually it's a challenge because sometimes you can get a big bill.
To get extra funds to raise finance, the hospital is setting up a guest house which will house volunteers, including doctors and interns from abroad and Uganda.
If we say that we are going to overcharge, then the people run away, and then we shall not achieve our goal.
Yet with all these monumental challenges, this mission hospital, founded by Mother Kevin of the Little Sisters of St. Francis in 1914, continues to offer services to the local community. In one of the poorest locales in the country, which has one of the highest fertility rates, this hospital in Aya treats 50,000 outpatients and admits another 1,000. Florence Naluyimba, NTV.